My name is Daniel Lewis, and this is the sub-Q heparin injection. So the first thing I'm going to do is verbalize the six rights, which is right patient, right medication, right dose, right right time, and right documentation. I will perform hand hygiene. The next thing I'm going to be doing is check the physician's order to see exactly. So in this case, it's heparin 5,000 units sub Q every 12 hours for 3 days. And in this specific ampule, each milliliter contains 10,000 units of heparin. So I'm going to be doing a half milliliter injection. So I am going to grab my ampule, check for any cracks and make sure it's not expired, make sure all the medication is down at the bottom, and I'm going to wrap a alcohol pad around the top of it, and with a quick braking motion, snap the top off away from myself, and then I'm going to put this down. And for this one, I have a 27 gauge with a 1/2 inch needle, and I'm going to go ahead and remove this needle, which is still capped, and attach the what do you want to call this? The filter needle. So I'm going to insert this into. It's kind of hard to see. I'm going to insert this into the ampule without touching the neck of the ampule. And I am going to withdraw 0.5 milliliters. Which is about right there. And I'm going to get all the air to the top to make sure I'm exactly at 5 milliliters, which right there I am. And then at this point I am going to pull back 0.2 milliliters of air. So total I will have 0.7 milliliters in the syringe. So at this point, I'm going to recap this filter needle. If I can, it's rolling around on me. There we go. And I'm going to remove this needle. And I will insert the 1/2 inch 27 gauge needle back onto it. And make sure again that I have 0.5 milliliters of heparin and 0.2 milliliters of air. I'm going to put this ampule over there. So I'm going to dispose of this by putting it in a sharps container. Alright, so I'm going to go to the patient's room. And so, knock, knock, knock. My name is Daniel Lewis. I'll be doing, I'm your nursing student today. So I will perform hand hygiene. And if the patient's laying down, I'll have them sit up a little bit. I'm going to be choosing their abdomen, let's say the right side of their abdomen, to do this sub-Q heparin injection. So once I get in the patient's room, I'm going to ask them to please state their name and date of birth for me so I can make sure that I do have the correct patient. At this time, I'm going to put on clean gloves. I'm going to ask them again to make sure they don't have any allergies of any kind, which they don't. Alright, so I'm going to open an alcohol, and I'm going to clean the injection site, if I can get the alcohol pad out of here. And I'm going to start in the center in a swirling motion and slowly work my way out. And I'm going to let that dry completely. At this time, I'm going to uncap the needle. Why would you do this to me? There we go. Uncap the needle. And for an injection like this, I'm going to pinch up the skin and make sure the medication is on top. Or sorry, the medication is on bottom. The 0.2 milliliters of air is on top. And I'm going to inject this at a 45-degree angle. And once I have that in, I'm going to use my left hand to stabilize and slowly inject the medication with the 2 milliliters of air. Going to wait a second, and then at the same angle, pull the needle back out. At this time, I would put it into a sharps container, which I don't have a sharps container, so I'm going to go ahead and recap the needle. If there was any blood or anything like that, I would blot away with a cotton ball or something like that, which I don't have a cotton ball. And then I will go and document on the MAR everything that I just did. So the medication, the site, the dose, all of that.